Denver, Colorado's never stood center stage in those eye-popping moments of historical concoction that begs for someone's complete attention. Neither have we been the model city for new ideas and innovations, but our mile-high location gives us a bird's-eye view, and the people in Denver are diverse and progressive, which is needed in these changing times. Creativity is the soul's expression, and art as a social medium has been the foundation of many programs in Denver. Beginning as early as the 1980s, the Sisters of Color United for Education have been on the front lines tackling social ills that inflict the local communities with health issues. Moving to our present location at Plaza Aztlan, we have created a safe space for many of the underserved and uninsured, where people can get referrals to basic needs and work to improve their sense of well-being. From the early days of the AIDS epidemic, some of Denver's citizens have worked to improve health conditions from various departments, like Denver Public Health Liaison Toby LaRue.
My name's Toby LaRue, and I do health intervention and health research with agencies around the city. That's where I've been involved with injecting drug use and HIV prevention for just about 20 years, coming up in a few months. Well, the very first program, a demonstration project in the early 90s, was the REACH program, risk education aimed at community house. From that program, delivered other agencies that came out and wanted to also help with the injecting drug use. Latin Crossroads was brought up. Also the RUG group, Regional Users Group. The name came about because they felt that if they called themselves RUG, it was like a statement saying people are always walking on us anyway, let's do something about it. I think the prevention programs now versus early stages, there was enough funding from the government to actually go out to the communities, teach people what was going on, teach people how to use condoms, teach people how to clean their rigs so they don't contaminate each other. I think now that we've really pinpointed the HIV epidemic, where it has the most HIV numbers are in men who have sex with men. The government sees that as the biggest problem, so the money and funding is set that way for preventions with positives.
Bringing around the focus to see things from the perspective of those most affected by the issues allows for a uniformed approach to public health on a greater level. With groups like Colorado working together, where even local citizens like Juan Nunez and Cheryl Thompson are welcome to voice their concerns and see that policies are inclusive for people from all walks of life.
Hi, my name is Cheryl Thompson. I'm from Denver, Colorado. I was born and raised here. I'm a nurse aide and a CNA. I'm trying to get a Cat 1 drug and alcohol addiction treatment. I started using drugs when I was about like 30 years old. I was slow on using it. So the people I used to hang around with, they used to always run upstairs and sit me downstairs with the weed and the gin, and they run upstairs. I said, what is y'all doing? And I begged upon it. They kept on saying, nah, this is not for you, and this is not for you. And a year went by, and they said, well, we're going to give you some. Don't you never let nobody hit you up. You learn yourself. So that's how I got all these scars on me. This is the drug use. This is what the drugs did. This is from like abscesses, misting abscesses and stuff like that. You always need a clean needle, different cotton, a cooker, and clean water. And at that time, I didn't know about that. I started selling crack to keep my habit up. And I got cases going back and forth to the penitentiary, and that's what made me stop, wake up and, and try to, check myself and put myself into some kind of treatment. What helped me is going to different places like Empowerment and Sister of Colors. They have helped me a lot. It helps me, like I said, I was focused on trying to get my Cat 1, trying to help on drug and alcohol, be a counselor to help people, not to use, drugs or any other, situation at that time. And I've been to all their classes, and they helped me. They helped me a lot. Like, I stay focused as long as I have something to do, to come out here and work, to help them out.
The hard reality of the street is often clouded through media and Hollywood portrayals that incite fear and mystery, leaving the untrained eye incapable of deciphering what goes on behind the scenes. Separation has given us a judgmental lens through which we perceive our collective consciousness. And when people believe that the world is sick, they often find themselves infected. Your mind cannot perceive something that you have never imagined. Shadows often hide the unspoken truths. The amount of suffering that a human being can endure is irrespective of believing that some human beings are destined to withstand immeasurable hardships. The possible real excuse is that they suffer for our well-being, and that without them, we could never realize our imagined sense of security. Human society has imprisoned itself with an overdose of information and knowing just enough useless data to form hundreds of agreements about life. But the simple truth would simplify those agreements. Maybe we could live with only 4. Some of us that have the unique opportunity to direct social policies are responding in such a health-oriented approach. Money may still be the bottom line that business operates in, but community engagement means getting your ideas about what health issues are affecting your daily life. In collaboration, Sisters of Color United for Education has tried to positively input systems change. We believe in harm reduction because it deals with the situation at that very moment, because it looks at populations without judgmental or stereotyped presumptions. From 1982, the injection drug user population became a priority to public health due to the high infection rate of HIV. Needless to say, blood banks had not previously tested donated blood for the virus, and IDU were a major pool of blood donors throughout the country. Denver started 3 pilot support groups to get valuable information to these people through Latin Crossroads, Empowerment, and the Action Center. The groups were segregated on racial lines, which did not prove to be effective. Once again, the street people had a lesson for the policymakers. Community groups formed together in a collaboration of agencies that provided services for IDU. They set their eyes on modifying state policies that previously prohibited open needle exchange. Other states had already shown that allowing people to get easy access to clean needles could reduce the rates of infection. In 2010, a bill was drafted that passed in the state assembly. Seldom do we consider the immense details involved with getting our ideas to become law. Often that is a benefit to ensure that all people that will be affected can have their concerns addressed. But sometimes the process can be manipulated to block or prevent new ideas from forming and changing the way our society is governed. The legal process is constantly trying to catch up with the changes in society, and for a time, services, some businesses, and even people's lifestyles have to operate underground and behind the scenes. Fortunately, here in Denver, we have matured enough to expand some of our basic services. And when we find ourselves at the intersection of where our paths cross, let us not rush to judgment or give first impression the only weight of consequence. The more we learn from one another, the easier we can coexist.
Take it back to the essence in the park. Hip hop bump in the barbershop. Let's take it back to the beats. Kiss the DJ, grilling up grub on a Sunday. Now this a drop for the mind.